You are listening to the third episode of Vibe podcast series. My name is Sarah. I am your host. This podcast series are about different aspects of healthcare. They are shared online on Soundcloud, AudioMack, and different other platforms in order to reach to so many of you listening. And today's topic is interventional radiology. I have a guest. He is a doctor, a radiologist at Kanombe Military Hospital. Dr. Ivan, you're very much welcome to this podcast.
Thank you so much.
So I made an introduction. We have people listening and they're curious to know a little bit more about you.
Thank you so much. My name is Ivan Rukundo and I am a vascular interventional radiologist and I work with Rwanda Military Hospital.
To somebody who just heard interventional radiology for the first time, what would you tell them what it is like? A little description, how it is important to healthcare, just a bit description.
Thank you. So interventional radiology is a clinical specialty, but more especially a subspecialty in radiology. And it uses cutting edge imaging technology in diagnosing diseases and treating diseases. So it's mostly known that radiology is used for diagnosis of diseases using imaging technology. So what interventional radiology adds is getting into the human body for doing different diagnostic procedures and also again getting to the human body with image guidance to treat diseases. That's what interventional radiology is.
Interesting. What made you feel inspired to choose interventional radiology as a career?
Well, that's a long question. So my story is a little bit different when you compare it to other people who are doing medicine as a career. I did my high school with a plan of being an engineer, an aircraft engineer. So I did what they used to call then math physics. That was math mainly as a major combination and physics. And during that time, I thought I was going to do more about technology, but I had this love for technology and machines and everything. But at some point during the end of my high school, I met one of my teachers who was Kenyan, and she gave us an exam which was a biology exam, and I think she was really impressed with the marks I got. And she introduced me to these two books of Ben Carson. One of them is Gifted Hands. And Ben Carson is one of the famous Black American neurosurgeons. And so I read them, and she told me a lot how she thinks I could do medicine. And at some point I changed my mind. After high school, I got a school in a technology school, university that was called KIST by then. But I had to go to the education board that time to ask to be turned to medicine, to do medicine. So I was admitted at the National University of Rwanda by then, and I went to do medicine. That's how I started doing medicine. So interventional radiology was something different. When I went to medicine, I met a lot of things that I didn't kind of like, because there was a lot of biology, a lot of chemistry, a lot of clinical work. And all my life I thought myself as someone who's going to deal with machines and a lot of technology. And during the course of my medical training, I came across radiology. Radiology used ultrasound machines, CT scans. By then we didn't have MRI machines. And I loved how it's used to actually impact healthcare, to treat patients, how it's used to contribute to treating of patients. And I was like, I think this is something I have to do. So that's how, in the first place, I fell in love with radiology, and I think interventional radiology came after that.
I personally, I did mathematics and physics in high school. Now I understand changing from mathematics and physics to medicine. Was it that easy for you, or because of the passion you just got adjusted?
I can't say that I started with the passion of medicine. I think just like anyone who did sciences, most people who do sciences just have this belief in themselves that they can do everything. So I was lucky. I really balanced my subjects. I used to do very good in math, did very good in physics, did very good in chemistry and biology. So I had this belief that I can do it, and over the course of my medical school, I figured out what I can do better, and I found that radiology was what I could do better.
With the case of Rwanda, how would you describe interventional radiology? Like, is it something that people are aware of? Is it developed compared to other countries?
That's a great question. Interventional radiology is relatively new in Rwanda, just like in other countries in East Africa.
Yes.
So when I say relatively new, I don't mean it's very, very new, because we've had some basic procedures of interventional radiology done in Rwanda from, let's say, 2008, 2009, and other years by some of the diagnostic radiologists we have in Rwanda who have had exposure on interventional radiology procedures. So there are procedures that are not new in Rwanda. And we've also had some visiting radiologists also have some skills in interventional radiology, especially for the basic procedures. So we've had some procedures done before. But in terms of starting it officially as a program, as a training, as a service, I would say that it's new. And we are only going to get it better. We are going to start we are actually started the service, and we are soon starting a training program to have more interventional radiologists and staff, and the service is going to grow, I'm very sure.
Thank you for that. You're one of the pioneers of the Tanzania ARR initiative and a board member of the Road to ARR organization. Can you tell us more about Road to IR?
Oh, thank you. Road to IR is an NGO, non-profit organization, and it's a consortium of that has a lot of faculty from different universities, mainly from North America, and also the board members also include me and some other former trainees who are actually pioneers of the pioneer trainees of Road to IR, and its aim mainly is to establish interventional radiology as a training programs in East Africa.
You have experience working abroad. You just even mentioned something about East Africa. Just got to see that you had an internship in Germany, work in Tanzania. If you compare those markets to Rwanda, how are they different when it comes to the level of education, number of doctors, AR awareness and development?
Thank you. So let me just go back a little bit to my observership in Germany. So my observership in Germany was when as a medical student, and I particularly did not do it in interventional radiology. I did it in interventional cardiology. And I visited a heart center in Eastern Germany in a place called Leipzig, and that's where I knew that you can use imaging to actually do treatment. But this time they were using imaging to do cardiac procedures. But I wasn't very much interested with cardiology, but I later on found that you can use the same imaging skill set to do procedures all over the body, which is interventional radiology. And that's how I ended up in interventional radiology, in short. So I can't say much about the German way of doing interventional radiology and the awareness in that, but I can talk more about what is there currently, probably in the Western countries and in East Africa, which is where I trained, particularly in Tanzania. So Tanzania is also, IR is also new in Tanzania. I would say that the service and training program, service started in 2017 and the training program started in 2019 officially, but we had started training since around late 2017. And so if you can compare, that's like 4 or almost 5 years down the line. So it's still new, but I can say it has developed significantly in the past 5 years, thanks to Road to IR and very many partner institutions that worked with it, and also the University of Muhimbili and Muhimbili National Hospital. All these came together and started the program, and we got very different donations and contributions from different universities, and this is how interventional radiology existed in Tanzania today. Today, as we speak, we can Tanzania is doing procedures like TIPS, which are like one of the high-end procedures in interventional radiology, other vascular procedures, big vascular procedures, and we're talking about 5 years ago, probably 4.5 years ago. So it can only grow bigger. So when you compare it to Rwanda, as I told you, there are some basic procedures that have been done in Rwanda for the past few years, but the aim of the training program and the service that we are starting in Rwanda now is that we can build interventional radiology as a service, as an established service, and train healthcare professionals, interventional radiologists, interventional radiology nurses, interventional radiology technologists, so that this exists as a service, as a sustainable service with a trained healthcare professionals. And I would say that this is going to grow. About the awareness, not very many people know it, but when you say like doctors, some doctors know about interventional radiology, or they have heard about it. They probably don't know the full scale of the full range of what interventional radiology can do, but there is some basic knowledge on what interventional radiology can do. Yeah, that's what I can say.
Well, that brings me to asking you, what are the challenges you're facing in your daily work?
That's a great question. So challenges are there, but again, you can see them in a lens of also being the same opportunities that we have. So challenges are challenges that are linked to the fact that this is a very new, relatively new specialty in the country. So, and the services that interventional radiology can offer in the country are new. There are a lot of things that are not there. You don't have, we have the main equipment, but when I talk about main equipment, most referral hospitals in Rwanda have at least a CT scan, an ultrasound machine, an X-ray, fluoroscopy machine, and probably only one has an MRI. So those are big imaging equipment that we use. They're available. But when we talk about consumables are not available. Very few are available. And this is only because these services were not there. And the same consumables, almost the same consumables are used by another relatively new specialty in Rwanda, which is interventional cardiology. And I think that as these two are growing, it's going to grow. But as for now, we still have that challenge. Another challenge is lack of trained personnel. We don't have, interventional radiology works as a comprehensive team, which includes doctors, nurses, and technologists, all trained in interventional radiology. So we don't have that. I'm a trained interventional radiologist, but I don't have any other fully trained interventional radiologist. We don't have trained interventional radiology nurses. We don't have trained interventional radiology technologists. And this is the whole reason of trying to start a program to train these people and make it a sustainable program.
Dr. Ivan, after telling us the challenges you're facing in your daily work, and now I am to ask you, how would you suggest that healthcare, especially in your area of specialization, can be improved even more? Like, what could be done to overcome those challenges?
There are many things that can be done. Starting a new program, training program, new service requires a lot of stakeholders. I would say the first being the government. And I'll just highlight on a few things that as we talk now, the Ministry of Health through the Health Human Resources for Health Secretariat have signed an MOU with Emory University to support in starting and training interventional radiology in Rwanda. So that's one of the things that I would suggest would happen so that interventional radiology can be established in Rwanda. Other things is involvement of hospitals, because this is a clinical practice and it happens in hospitals. So hospitals need to understand that there is a need. And we have been having a lot of patients who lack these services in the country, and they go in countries like Kenya, South Africa, and India to go seek these services. Now we have people who are ready to support us start this program. The Ministry of Health is ready to start this program.
Yes.
And this program is going to happen in hospitals. So we need leaders of hospitals to also be on board and do as much as I can to support this. So that is in terms of clinical and healthcare clinical services, and policy. Then there is also a component of training, which includes the university. And speaking about this, I would say the National University, the University of Rwanda, particularly the College of Medicine and Health Sciences. This is one of the entities that we also need to be introduced to be part and parcel of this, so that we can train people for the long term of this specialty. Outside that, we can also talk about equipment. There is limited equipment, particularly consumables, and this calls up for one, the government, because there is a policy entity to that, to bring, to let new equipment that are going to serve in these new domains to be available easily on the Rwandan market. But not only that, there's also the part of those who sell equipment. That's, I think, an opportunity for industry to make this equipment available in the country. And because they're not there, or they are very few, probably not available or not available on time. So all of these things need to happen so that these new services, particularly interventional radiology, can be exist.
The government of Rwanda has been investing a lot to improve its healthcare infrastructure. So according to the reading, or according to how the government is emphasizing on promoting healthcare, what is the projection of radiology? Like, if you could say, in 5 years, I see this and this happening.
Yeah, thank you. I agree that the government has been doing a lot. And I will speak particularly in radiology. 7 years ago, we did not have trained radiologists who were trained in Rwanda. As we speak now, we have an existent residency program for radiology that started, I think, around 2015, 2016. And that's a very huge milestone. And we cannot speak of interventional radiology without speaking about radiology, diagnostic radiology. So since the government put in a lot of effort, together with the Rwanda Society of Radiology, to put up a radiology residence program that now has graduated 3 graduates, and they have another class that is graduating soon of 3. They have another class of around, I think, 3 or 4. And then they have another class, I think, of 5 or 6. So that's a growing number. We are soon going to have a good number of radiologists trained in Rwanda. And we can build on that to also get graduates join interventional radiology as a training. That is not only, I am just speaking about their investment in education, but there's also a huge investment in infrastructure. Rwanda Military Hospital, Seashika, King Faisal Hospital have now very great imaging equipment. And that means that we can have diagnosis made using imaging in this country. When you go back, even in 2008, we really had very few imaging equipment, state-of-art imaging equipment. We didn't have an MRI, I think, in 2006 or 7. We didn't have an MRI. But now we have MRIs in the country. Even in private sector, we have MRIs, we have CT scans in the country, in major hospitals in the country, and in private practice. So that's a very great initiative, and that's a great contribution of the government to improve healthcare, particularly in imaging service.
That was very informative and educative. Thank you for listening to today's podcast, and thank you, Dr. Ivan, for sparing your time and have this conversation with us.
Yeah, thank you so much.
Keep streaming, liking, commenting, and sharing this podcast to help us raise awareness about different aspects of healthcare. Also, visit our social media platforms as shown on the screen for more interesting contents and updates. It's Vivek, and see you next time.